My Tuesday, good morning everybody. My Tuesday lecture today is related to a troublesome and long-standing injury, the anterior cruciate ligament injury. And during my presentation, I will use ACL injury as an abbreviation. Before continuing, I wanted to say that in continuity of my previous presentation on groin, if you remember it, I will try to relate the challenge of a practitioner on field, the sport physician or physiotherapist, when he have to ask himself the right question and to give the right answer to face the daily challenges in an attempt to apply the best practice through relying on the best available evidence and his own experience. You've noticed that I began my presentation with a question. So is there really an ACL injury epidemic among Qatar professional football players? And I will try to ask you, I will give you two short questions. Do you think that there are in Qatar too many ACL injuries? If you try to remember during the last seasons, do you think that there was too many ACL injuries? Can you raise your hand if you think yes? Not so many. And do you think that there was too few ACL injuries? No one. Okay. Okay, so I hope that when we reach the last slide of this presentation, we will have the right answer to this question. I have no conflict of interest to disclose in regards to this presentation. And in the learning objectives of this presentation, our objective will be to analyze the epidemiology of ACL injury during the last 5 seasons, associated with the main characteristics of injury incidence, injury severity, which is the injury burden, and pattern and specificities of injury like contact, non-contact injuries, recurrence or no, and so on. We will then try to compare our findings to the literature, especially the UEFA Elite Club study. And in the end, we will try to identify perspectives for further studies based on video analysis to try to understand this ACL injury mechanism in an attempt to set accurate and effective ACL injury preventive programs. When a damaging force occurs on the knee in football, it could be by a direct contact, by a blow from behind the knee, obliging the knee to hyperextend, or from the medial side of the knee, and the knee will be forced to go inward. You all remember perhaps images of players' knees buckling after getting tackled hard from behind or sideways. The injury mechanism could be also an indirect contact on the foot, for example, forcing the knee to go in in valgus stress. And also there is indirect contact injuries in which, in football, of course, we are speaking in football, in which there is cutting, pivoting, sometimes jumping with landing on one foot, for example. And when these conditions are associated with failed dynamic protection, an ACL injury can occur. An ACL injury in a professional football player is potentially a career-threatening injury with a highly variable time loss, with also financial cost, direct financial cost related to the surgery, but also the long rehabilitation process, and indirect costs related to the costs supported by the football team hiring this player, because they will lose his services for months, and in addition to his salary, of course. There is no warranty for the football player to retrieve his top-level competition, and a paper by Valden and colleagues found that only 65% after 3 years of injury come back to their prior level of competition at the same level, to the top level of competition. And there is significant potential for early onset of osteoarthritis. Now let's see the opinion of one former international football player, sorry. He was captain of the Qatar national team, and he's actually a coach in Qatar First League. Mr. Wissam Rizk.
بسم الله الرحمن الرحيم. وسام رزق لاعب دولي سابق. بتكلم اليوم بشيء بسيط عن إصابة الرباط الصليبي. طبعا إصابة الرباط الصليبي الكل يعرف أنها أصعب إصابة ممكن تحصل للاعب كرة القدم وبتكون مؤثرة في مسيرته الكروية أو حياته الكروية. الإصابة الكل يعرف أنها إصابة مش عضلية، فبالتالي تأخذ وقت طويل، ممكن تأخذ حق 6 شهور واللاعب بنفس الوقت ما يرجع نقول 100%. نتمنى أن ما حد تجيله، لكن هي واقع في كرة القدم. بالنسبة للإصابة عندنا هنا في قطر موجودة، وفي عدد كبير من اللاعبين أصابتهم هالإصابة، لكن دوم أنا حاليا مدرب كرة قدم، ودوم أطلب من الطاقم الطبي أن الحماية للاعبين وشلون نقدر نحمي اللاعبين من الجهة الطبية. فبالتالي دور الأطباء مهم في هالإصابة، وبنفس الوقت دور اللاعبين مهم بتقوية العضلات، وبالتالي إن يتفادى الإصابة. نتمنى حق الجميع السلامة إن شاء الله ومستوى طيب.
So you've seen the opinion of a former football player, a coach also. We understand that as a medical staff, technical staff, or even the administration staff of any club, we will have to figure out how to prevent this severe injury and not just watching our statistics. A recent paper are bringing evidence that ACL, bringing evidence about the role of some exercises and especially the FIFA 11 plus warm-up program on preventing ACL injuries. Some other papers like Frank and colleagues are underlying the fact that neuromuscular training, plyometric strengthening exercises, but also feedback to athletes on proper technique could not only prevent ACL injury, but also improve their performance. However, some stakeholders could argue that in literature, there is no easy to implement protocols. We know that proven ACL injury practices, injury prevention practices exist, and many of us will agree that preventive measures are efficient. However, and consistent with the Van Mechelen model, we have to begin with the first step, which is to assess the extent of the injury problem. And in here, we have to define the number of injuries, the mechanism, the type, the location, the severity, the frequency, to be able to implement, to implement action plans. In this context, there is plethora of papers in literature dealing with this topic with the ACL injury rates. However, when we check for Middle East, there is no paper dealing with this topic. At the time that, before doing our study, I will talk later about it. And you could say that we can use this data available in literature. However, we know that ACL injury differ according to geographical regions, according to the climatic condition, to the pitch grass type, and patterns and characteristics of injury can evolve with time. That's why we need our own data specific to our own population in our region with our climatic conditions. Now I will show you a photo. And I will ask you, what do you see? Some of you, if they look from the left to right, they will say a rabbit. Some other could say a duck. So from this optical illusion, we understand that every one of us will have his own vision and his own impressions. In sport, like in daily life, in our daily life, we build our own impressions, which could be false sometimes. We bring our preconceptions, and we hear about news and rumors. Despite the fact that rumors have sometimes some attractive side, we have to know what is right from what is false when we work on the field. I remember one journalist who asked me one time why we have so many ACL injuries here. I asked him, why do you think we have so many? He told me, look to the numbers. Why do you think the opposite? So here, as a medical staff in a club, in a professional club, we have to have the right answers and the right explanation when we argue, not only with media, but also with our coach and football player. And in our case, what was a rumor became for some people a belief that we have many ACL injuries. Why? Because people like to believe in numbers. They will say, we had 3 ACL injuries in September 2013. January is the month of ACL injuries. In 5 seasons, we have 7. However, as a medical staff, again, we have to rely on evidence. And when we rely to evidence, you've seen that there was a need first to understand the extent of this injury. Is it frequent or no among our football players? We understand that prevention is important, not only for us to be performant in our work, but also to convince the coach, the football player, and then other stakeholders like media about the real epidemiology of this injury. And all these reasons underlined the idea behind this study. You may know the golden circle concept. I extrapolated this concept to this presentation, to our topic, to try to explain the different steps we followed to reach the result that I will give you later. Of course, the why I already explained it. And when we knew that we had to do this work, we said that we have to assess the injury incidence, the injury severity, the injury burden, and the characteristics of the injury in terms of contact, non-contact, recurrence or no, and other parameters. But how? Based on our 10 years prospective epidemiology study in which we are reporting the ACL injuries among all other injuries, as well as the exposure to matches and training, we did a retrospective analysis of the ACL injuries that happened during 5 seasons from 2013-14 to 2017-18, and it concerned 2,243 player seasons for 729 team months. I like this photo because it represents the unity and the collaboration of the NSMP staff, even though this photo dates from a few years ago. In fact, the data that we are using is obtained from the Aspetar Injury and Illness Surveillance Program, recorded by this medical staff assigned to each club on behalf, of course, of National Sport Medicine Program. All medical staff used a standardized reporting system that has been established based on the consensus statements on injury definition, of course, and data collection procedures in previous soccer injuries studies. And we included professional male soccer players who sustained an ACL injury during the last 5 seasons, as I already stated. And injury that occurred outside the team's activity were excluded, as well as partial ACL ruptures. For the methods, training and match exposure were calculated for each player during the 5 seasons. Injury incidence was calculated as the number of injuries for 1,000 hours of exposure to matches and training, as well as the injury burden as number of days lost for 1,000 again of exposure, 1,000 hours of exposure to matches and training. We did the Poisson 95% confidence interval to calculate the incidence rates, and difference between incidence rates was calculated based on techniques described by From and Chukwe, and a linear regression analysis was used to analyze the time trend of the injury rates among the 5 seasons. A cutoff of statistical significance was set at less than for P at P less than 0.05. Now time for the results. The average age was 25 years, and the exposure was the total exposure was nearly 487,000 hours for 70 club seasons. There was among these 37 ACL injuries, 22 in matches and 15 in training, and the mechanism was nearly for 50% contact injury and non-contact for the second half. Now, the most important result is the overall ACL injury rate, that was 0.076 for 1,000 hours of exposure, and 0.5 ACL injuries by team by season, and I will come back later to this result. Here we have the distribution of the ACL injuries during the 5 seasons, and you will note that there was no significant difference in ACL injury incidence across the 5 seasons. Three ipsilateral re-injuries occurred, and the index injury, that means the first ACL injury for these recurrent injuries, occurred before the beginning of the study, I mean before the 5 seasons of the study, before the season 2013 and 14, and there was no contralateral ACL injuries. The overall injury burden was nearly 16 days for 1,000, of course, hours of exposure, and there was no significant difference in injury incidence between pre-season, first half, and second half. Pre-season is July and August, first half September to December, and second half from January to June. Now let's talk about the injury incidence in matches and training. In matches, it was 0.41 per 1,000 hours of exposure, and in training, it was 0.04 per 1,000 hours of exposure. You will notice here, obviously, that the injury incidence in matches was higher, statistically higher than the incidence in training. And concerning the strength and limitation of our study, I could say first, regarding the reliability of data monitoring, that the fact that we are working in a unique setting where all the teams of a single league are covered by medical staff using a standardized surveillance program is a big advantage. Secondly, the sample size covering the majority of professional football players in Qatar. As a limitation, 3 teams were from second division with different playing styles and standard of players. However, these 3 teams were also professional football teams. Finally, the non-constant number of teams followed by season could be a challenge. However, it was counteracted by the fact that we had reliable data collected by staff collecting daily the exposure to training and matches, as well as the injuries and illnesses. Now let's compare our findings to the literature, especially the UEFA Elite Clubs study. You know, the UEFA Elite Club study, it was it's a long-term prospective study that began in 2001, interesting 16 countries and about 78 clubs, I think. And we are interested in the sub-study by Walden, who assessed the ACL injuries. They found an incidence for overall ACL injuries of 0.066 injuries for 1,000 hours, and there was no statistical significant difference with our study injury incidence. If you remember, it was 0.076. No statistical difference again. For them, there was a non-significant 6% average annual increase in ACL injury rate, not found in our study. And finally, a median absence nearly of 200 days, again in line with our 204.5 days reported in our study. Now, concerning the ACL injuries in matches, comparing the incidence in our study and the UEFA Club Elite study, it was a similar result. There was no statistical significant difference. However, the training injury incidence rates in our study were higher, nearly the double or little bit more of the injury rates during training in the UEFA Elite Club study. You understand then that the training injury rate was 25 lower than match rate in the UEFA study and only 11.8 times lower in our study. To understand why, there is a possible reason for this, that in Qatar, during the 5 seasons, there was between 12 and 14 teams. And they were playing between 22 and 26 games in a season. If we take the European football leagues, the biggest ones, let's say Spain, England, Italy, they have 20 teams. And when we say 20 teams, they are playing 38 games during a season, in addition to the European competition. So they were playing more matches, and the ratio for training to match exposure was higher in Qatar than in the European football leagues. And this could explain the higher rate of injuries, ACL injuries, during training. Another possible risk factor for high training injury incidence is the quality of the pitches during training, which could be different from the match pitches. It depends, of course, of the pitch hardness, rotational traction, for instance, and the evolution across the season. And some subjective reports said that there is lower standard of pitches for training than match pitches. Here we understand that the relationship between ACL injury mechanisms and the pitch characteristics, the boot type, and the foot and field interaction needs more scrutiny and research. Again, in our study, each team involved were expecting to have 1 ACL injuries every 2 seasons, 0.5 every season, and it does not appear to be higher than the findings in the literature. Now, for the re-injuries, ACL injury rate was 8.1%, which is approximately twice or a little bit more than the finding in the UEFA study. And when we search with the literature, there is a possible risk factor for graft rupture before returning to play, which is not meeting discharge criteria, functional tests and muscle strength, but also the decreased hamstring to quadriceps ratio. And here we understand that we have to improve our return to play decision, our compliance with rehabilitation, and of course our prevention of ACL injuries. Now that we discussed our results and compared them to the findings in literature, what next? Do we stop here? There is an after this. Let's see the official teaser trailer of our next step. Look to the right knee of this white t-shirt player. There will be a zoom later. Look now here. We have the injury mechanism. Do I put it again? It's enough, okay. So, we know that precise mechanism of injury is important to know to implement accurate prevention methods. That's why further large-scale video analysis studies of ACL injuries have to be implemented to understand the specific injury mechanism found in Middle East and in Qatar for our case, to be able to implement, as I said, specific preventive measures specific to our location, to our regions, with our own conditions. In literature, we can find some injury mechanism of non-contact ACL injuries, like pressing forward by kicking and heading, knee valgus regardless of the player position, or rarely dynamic valgus collapse, of course. I will not go further in this because it's for the next step, for the next presentation perhaps. So, our paper was published in the BMG Open Sport and Exercise Medicine. It's an open access journal. ACL injury incidence, severity, and patterns in professional male soccer players in Middle East League. Here are the authors. And here I want to thank all the authors of this paper who helped me to make this work. Without their valuable input, it wouldn't be so good. And here you see among the authors Dr. Philippe Landreau, who just left our hospital, but will keep good memories about his kindness and professionalism. Also, Professor Karim Shameri, who is always keen to help field doctors and physio, not only to find the available evidence, the best evidence, but also to build their evidence. And it's not easy for people working in the field far from the research sometimes. My first take-home message is that the overall ACL injury and time loss rates among professional male soccer players competing in the Middle East, is similar to professional European football leagues, with a higher, however, re-injury rate and a higher ACL training injury rate on which we have to focus. There was no period of the QSL seasons with a greater risk for sustaining an ACL injuries. As I said, the pre-season, the first half of the season, second half of the season. Because in the beginning, honestly, I was thinking that the first half was with a higher risk, but our data showed me the opposite. My second take-home message is that practitioners in Middle East professional soccer now have benchmark ACL injury rates to support their practice, daily practice, and they need to improve the prevention of ACL injuries during training sessions, and also to prevent ACL re-injuries by understanding region specificities. As a conclusion, and as I told you, I did this presentation from the point of view of a field doctor. We have always to ask the right question, to search for the evidence for this question, to rely on literature, but also our own specific data. You see its importance in our case, to give the right answer, and then find the best practice. And when we reach our best practice, we can be only successful. Here is the references I used. And here is our last slide. So something to remember. There is no major variation in ACL injuries in Qatar Star League compared with European football. Thank you for your attention.